I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, today you want to talk about Duchenne.
Duchenne Muscular Dystrophy. Okay, this is a real terrible disease, Bob. It happens almost exclusively in boys, males.
Sure.
And it starts when they're an infant, but you don't realize it until they get older. What this disease does is it works with the muscles and you lose strength. And by 10 years old, most of them are unable to walk.
Okay.
Okay. 90% of them, of these people, develop scoliosis in their back, so their back becomes deformed. By the age of 14, on the average, self-feeding is very difficult.
They're no longer able to do so.
Right, right. And typically by the age of 20 or 30, it's terminal. Real terrible disease. We've had one person ask a number of times, can we do something on this? What do physical therapists do? There is no real positive or treatment that's going to be successful in making anything.
Changing the outcome here.
Right, the outcome's the same. It's a matter of making their life more tolerable. So we're looking at range of motion. I've never treated anybody with this personally, but I have treated a number of people that have
progressive muscular,
right.
Neurological diseases.
Right,
Probably.
from birth on. And this is what I do with them. Every 6 months, oh, we just have a little issue behind there. Every 6 months, I take measurements on the critical muscles that get tight.
Okay.
And with this disease, it's very common that the calf muscles or the hamstring muscles get tight, which is very common amongst a number of other pathologies.
Issues,
right.
Yeah.
So why don't you lay down, Bob? This is what you're going to want to do. And this is something you probably won't be able to do. You may have to have your therapist do it, but recommend it to the therapist, and they'll probably agree it's probably a good idea. Is you're going to measure the hamstring tightness with the 90-90 test, and we're going to link that up. We have a video just on the specifics on how to do it.
I'll link that up here.
Okay, right up there, Bob's going to put it. We're going to bring the knee up to here for the person while they're laying.
Which is a 90-degree angle.
Yep, 90-degree bend in the hip. I'm going to take a measurement here with your goniometer, and we're going to go up to here. And someone that's really flexible will go up to about here like Bob is. Oftentimes, people that have a disease like this, you might get to here. I just did this on a person this week, and he was at 80-some degrees 6 months ago, and he's getting better. He went up to about 60 degrees.
I just did this exact same test on someone yesterday,
Sure.
too.
It's a nice test.
Yep.
Then what you do is you have to document this, put the date and everything where you have it so it's consistent information, and every 6 months, it may be every year, but I would think probably in this disease every 6 months or even sooner, you're going to measure that. If these muscles are getting tight, then it's time to emphasize hamstring stretches, okay, whether it's once a day,
Sure.
2 times a day, or whatever it may be. This is where a therapist really should be working with this person for suggestions. The next muscle group, and you'll see when these people walk, a lot of times their toes don't come up. It's called foot drop. And these muscles here, the calf muscles, can get tight. So we're just going to simply measure. There you go. Measure the dorsiflexion of the ankle.
You get that angle? Is that,
Yeah,
there we go.
how is that, Lonnie? Okay. So typically on a normal passive range of motion for dorsiflexion, you're at 15, maybe up to 20 degrees. And you'll see as these muscles get tight, a lot of times just getting to 0 or neutral is difficult. And a score of plus or a negative 10 or 20, which would be down in here, that means we got to really work in and start stretching those dorsiflexors, that ankle, to get that up so that walking can last.
So a right angle, Brad, you want to explain, is 0?
Right. Right angle, so here we call that neutral or 0, or you could call it 90 degrees, depending on how you work. And that can get a little confusing. That's why a physical therapist understands that very well.
Right.
Then you're going to address that and focus that. There may be some other muscle groups too that this person in the arms or the back that may need to be addressed. I'm not going to get into all that because it's individual. So monitoring and documenting so you know as the person ages what you need to focus on.
What is getting tight.
Yeah, exactly. So once again, if you're working with this, it's a terrible disease, but these are some things therapists can do to help the person live a more healthy and happy life. So take care and good luck.
Good luck to you.